Viewers, you are watching our Critics Take channel. With the ease of lockdown, people are now in a great dilemma. On one hand, they need to travel through populated areas and avail crowded vehicles. On the other hand, the number of COVID-19 cases is jumping by leaps and bounds. But most worrying is the many myths about coronavirus which have been well spread through various kinds of propaganda, particularly via social media. If I have charted those myths correctly, they are like myth number 1, 2020 is the worst year because it has a sudden attack from a new virus. Myth number 2, with the imposition of strict lockdown, COVID-19 should have gone away by now. Myth number 3, COVID-19 is a deadly dangerous disease. Myth number 4, COVID-19 is a big killer and anybody infected with the novel coronavirus would very likely die. Myth number 5, coronavirus mutations make the COVID-19 worse. Myth number 6, someone can get COVID-19 twice. Myth number 7, the patients who tested negative upon recovery but later tested positive can spread the virus again. And myth number 8, which is perhaps the most relevant today, with the ease of lockdown, incidences of COVID-19 shall continue to rise, and that is actually life-threatening for all of us. In the next few days, it will be my task to shatter these myths logically and through the arguments that are based on science. But today, in the next few minutes, I shall deal with the myth number 8 first, because the most burning issue for today is people have to go to their workplaces and they are mostly concerned for it. I hope after watching this video, our lives will become much easier to live with the coronavirus. So let's begin with the myth number 8. With the ease of lockdown, incidences of COVID-19 shall continue to rise, and that is actually life-threatening for all of us. But this is not true. The incidences of COVID-19 in India are not rising because of the ease of lockdown. In fact, it is occurring naturally and there are reasons for it. After 4 phases of very stringent countrywide lockdown, India has started opening up the economic activity through the Unlock 1.0. The purpose of lockdown was to prepare for the pandemic and halt the spread. It was targeted to prepare the Indian health system. But COVID-19 pandemic has exposed that India lacks a robust healthcare system. Throughout the lockdown period, India's COVID-19 curve has been steadily rising. The first phase of lockdown, which spanned for 21 days, had registered 10,877 cases, while the fourth phase saw nearly 86,000 cases. At present, India is the world's 6th worst hit nation in terms of overall case count. When the lockdown started, India was nowhere on the chart and there had been a total 434 cases only. The lockdown in India has obviously not worked even by one bit. It's simply because the timing was too premature. The draconian measures were imposed much before cases had begun to mount. A lockdown should never be imposed either too early or too late. It must be put in place at the time of peak infection. Despite the lockdown, cases in India have shown no decline, and the reason is simple: faulty timing of the lockdown. SARS-CoV-2, which is the virus responsible for the COVID-19 is basically a respiratory virus. And every respiratory virus, particularly the flu virus, has a pattern. It emerges in winter, and after infecting people for 6 to 8 weeks, it retreats. The pattern of COVID-19 is also the same for almost all the countries. It has a rapid increase in new cases and then fall in number over 6 to 8 weeks. Unfortunately, in India, neither the government nor the media assured the public that more than 80% people developed mild or no symptoms of COVID-19. The majority of infected people would simply shrug off the virus with absolutely no harm to them or had no underlying disease, especially if they were young. And fortunately, most of the Indians are young. The moment a lockdown is imposed, you interfere with the natural progression of the disease. Therefore, it is quite natural that if the lockdown is lifted, the virus will come back roaring, because most of the people have not developed immunity against it while confined in their homes. So what is this immunity and how it is being developed? We shall address this issue later in our later videos. Initially, the cases in India have been remarkably few and deaths even fewer. Some may argue that the lockdown has been our great savior. It is not true at all. New cases kept coming each day despite the most draconian lockdown on the planet. But in Europe, they realized the futility of strict lockdown and therefore started to loosen it early. The number of cases keeps rising in India every day for the simple reason that more people are being tested now than before. Still, the present strategy of the government does not allow testing of all unless they are symptomatic, even if they already have had exposure to COVID-19 positive patients. Since 75 to 80% COVID-19 cases are asymptomatic, it is difficult to know whom to isolate in households and workspaces. Therefore, it is anticipated that there will be increase in cases when unlocking is done in phases. Finally, please note that the fatality rate of COVID-19 is less than 1%. In my subsequent videos, I shall address this subject in detail. But right now, I want to assure you that there is hardly anything to be worried about with COVID-19. Let's go out and learn to live with this novel coronavirus. If you have found my video useful, please press the like button and share the video with others. Also, please subscribe to my channel and press the bell icon to receive notifications for the future videos.